protect what we call text neck from looking down on our
Oh,
phones
yeah.
and computer. That can cause interference on the nerve from the bone misaligning from this posture, which then affects the heart and lungs. So that's the big picture I want people to understand. Spine controls nerve, nerve controls organ. You can get to the root cause, move the bone off the nerve, and allow the body to heal and function. I create a plan. How do we restore the integrity of the structure, get the curves where they need to be? How do we heal the disc space as much as possible? How do we stop arthritic spurs from getting to the next phase? So that's what it looks like in my office in corrective care, and why I look at spine for overall health.
Welcome back, everybody, to the Healthy Habit Podcast. I'm your host, Dr. Dayan, here at Healthy Habit Medical Center. And today, it's a first time having her on the podcast, but we've talked to her on Radioland before we switched to this new platform. Today, we're talking with Dr. Roxane Zamora, Doctor of Chiropractic Medicine, who's been practicing in North Phoenix at the same location for the last 14 years, going on 2 decades here. Dr. Zamora provides chiropractic corrective care and car accident care for all ages. Dr. Zamora, welcome to the podcast.
Thank you. I'm glad to be here. I wanted to just say too how much I love how you guys have changed. The store is beautiful. Your practice is beautiful.
Thank you.
Great job for the community and helping them in their wellness too.
Thanks for saying that, Dr. Zamora. So we set the stage there with the field, the field of chiropractic medicine. You're still going strong here 14 years later. What keeps you going in the world of chiropractic medicine?
You know, my mission is to help people be well. It's like you guys as well. When people think of chiropractic, they only think of, oh, I got a bad back or bad neck.
Right.
They don't realize that, I love that you have the ANS poster in the
Yeah.
background because that's important. The nervous system supplies every organ for our heart to beat, our lungs to breathe, arms, legs to move. You have to protect the nervous system because it's helping function every organ. And then what houses and protects the nervous system are the vertebrae. So a vertebrae out of place, let's say in your neck,
Yeah.
protect what we call text neck from looking down on our
Oh,
phones
yeah.
and computer. That can cause interference on the nerve from the bone misaligning from this posture, which then affects the heart and lungs. So that's the big picture I want people to understand. Spine controls nerve, nerve controls organ. You can get to the root cause, move the bone off the nerve, and allow the body to heal and function.
I'm glad you pointed that out, because imagine all the nerves, they literally come out of that spinal cord. And imagine if
Yeah,
if the foramen's too narrowed, and then boom, you go see
yes,
Dr. Zamora, and now that foramen's bigger. Wouldn't the nerve be
yeah.
able to kind of breathe better?
Absolutely. Research says a feather's weight of pressure on a nerve,
Right.
so just a feather's weight, right, on a nerve decreases the function of the organ by 50%. So if the
Yeah.
vertebrae is even slightly misaligned, which we would call subluxation, even if it's subluxated just by a feather's weight, the heart's decreasing by 50%, which then leads to heart disease. If it's in the middle of the back, it's going to the lungs, and the gallbladder, liver, stomach. Then you get digestive issues, right? So my goal is I start with x-rays and I see how does the structure look. Because when we look at that poster, you see there's a curve in the neck, the middle back, and the low back.
Right.
So I look and I see where is that curve, measure that, analyze it, and then I look at what phase of degeneration, because there's 3 phases of degeneration. So let's say the bone in the middle of your neck is misaligned. It's going to affect your thyroid. I mean,
Mm.
that's just 100%. And
Wow.
that's page 4 of Gray's Anatomy. That a feather's weight of pressure on a nerve will interfere with the function of the the nervous system and the organ. So I have to move the bone off the vertebrae. Again, we'll use the neck so that the heart and lungs are stronger. And if you ever have any numbness or tingling in your hands, then for sure we know that the vertebrae in the neck are misaligned, causing pressure on the nerve, the disc to degenerate, and health problems develop. So yeah, I like to start with x-rays always. We do x-rays in-house. I have a digital x-ray, which is a curse and a blessing at the same time. But I can't do them here because I want to see where are the curves, what phase of degeneration. Phase 1 is you lose the curve.
Oh, okay.
That's when it starts having aches and pains. Phase 2 is now the disc starts to degenerate. So degenerative disc disease, arthritic spurs develop, osteophytes. Now people are starting to have more constant aches and pains. Like it's not going away as quick as it used to, or it's the person who's like, all I did was pick up a pen and now my back hurts or my neck hurts. And it wasn't just that mere fact of that action. It had been degenerating for a while. And it got to the point where it pushed on the cord, on the spinal cord and the nerve. And then phase 3 is where it starts fused together. Herniated disc, degenerative disc disease to the next level. The vertebrae start fusing. And now people are having much more chronic health problems and a lot more pain. And since I do corrective care, that's why I start with x-rays. What phase of degeneration are they in? And I create a treatment plan. How do we correct that, right? So my office isn't a typical where you get 1 or 2 adjustments and you're done. I create a plan. How do we restore the integrity of the structure, get the curves where they need to be? How do we heal the disc space as much as possible? How do we stop arthritic spurs from getting to the next phase? So that's what it looks like in my office in corrective care, and why I look at spine for overall health.
I'm really glad you mentioned the thyroid. I mean, we see hypothyroidism, it's all the time. I mean, everybody has suboptimal thyroid health now. It's called like subclinical hypothyroidism because it looks good on paper, but they're having all the symptoms. So that's maybe the first time ever somebody's mentioned the potential connection with chiropractic and thyroid. I mean, that's tweet worthy. Twitter's my favorite social media platform, Dr. Zamora. So that would be a good little tweet. Chiropractic medicine is an underutilized tool for hypothyroidism potentially. Have you seen cases of that over the last 14 years where thyroid health has improved?
Yes, absolutely. And I always know 100% if they have thyroid issues, like their C3 or C4 in the middle of the neck are going to be misaligned. And I've had patients, it's interesting. I have a big jar here because I would have patients come in, they're like, guess what? I don't need my thyroid medication anymore since I've been getting adjusted. I see it a lot. And so we started collecting these empty medicine bottles as a testimony for people. I've had people get off statins once they're under care, because this is a great study, is people under chiropractic care reduce their pharmaceutical drug costs by 85%. I mean, that's huge right there. So part of my goal is to help people get off drugs, because if the body can start healing itself, right, by me removing the interference, it will. We just have to allow it to then be corrected, allow the nervous system to flow. So yeah.
That's unbelievable. Is it
It
mostly
also helps with sleep.
With what?
With sleep.
Okay.
Sleep, headaches, digestion. People don't always think about how your sleep is affected. A lot of sleep is, if this very first bone here, the atlas, if you lose the curve and the atlas pulls up, it literally pulls the brainstem down. And the brainstem is on a constant overload and it can't heal and relax. So problems like ADD, ADHD, headaches, insomnia, it can be helped by adjusting the cervical spine in your neck. So.
And you're nailing like 9 of the top 10 conditions right now that we're seeing in the United States, in North America, really, with
Yeah.
hypothyroidism,
Yeah.
anxiety, depression, sleep issues, and
Yeah.
mental health issues in general, depression. And what all those things have gone up in the last 50 years. And so have
Yeah.
cell phone use and people working on the keyboard and on their laptop with that hunched posture. So there's no way that's
Yeah.
just a coincidence that's at
Right.
least part of it. It's not the only cause of those issues,
Right.
but that's
But it's
got
a
to
big
be a huge
factor.
player, our posture.
Yeah. And you know what's
Wow.
interesting about myself too? I started my career as a psychotherapist in the mental health field. And when I first started, lithium is was pretty much what we would get. And I had severe people, my patients had schizophrenia, and they had been in a forensic hospital because they had typically murdered somebody, and I was their therapist. And we started with lithium. But then when Prozac came out, I was like, oh, great, because I very medically modeled then. I was like, oh, Prozac's going to be the answer to everything, right? But then I started seeing my patients who could function once I went to an inpatient outpatient setting
Yeah.
and had still chronic people with chronic mental health concerns. I saw Prozac making them sick. Mental health was deteriorating. And then I was like, I think something's going on with Prozac, right? I started questioning it because people who could function outside of the hospital were not able to and were hospitalized. And then I saw Effexor come out and Lexapro, and I was like, every new drug is making it worse for my patients. So I started questioning the validity of the medications, like these drugs people were getting for their mental health. And then finally I was like, God, I have to do something different. Because I had told a patient, if you don't take your meds, you aren't getting out of the hospital. And I was like,
Wow.
okay, it's no longer about psychology, it's about pharmacology. If your
Interesting.
only answer is meds, or you're going to be here forever, it was just medding them into compliancy. So I understand now the connection between the brain and body. If there's interference, of course, you're going to have some issues. Not that I'm saying that for people who have mental illness don't need medication, but there's also other factors you can consider. So in 2000, I went back to school because I no longer resonated with that kind of thinking. And I was like, in 2000, I went back to chiropractic college and I've been doing it since. So now I look at the body as a whole. What's causing some of the disconnects for people? And then how do we remove the interference and allow the nervous system to do its job? So
Amazing. Amazing. I can tell you just love the field you're in. I feel it. I feel that
I
it's a good
love it.
energy. Yeah.
Yeah.
We can all tell that. That's for sure. Dr. Zamora,
Yeah.
what big on my radar? I've been playing basketball since 1995, 96, since I was like 5 years old. And it's big on my radar the last probably 2 to 3 weeks is foot health. And because when I walk, my feet flatten. Like if I just
Yeah.
raise them up, it looks like it has a good arch. But as I walk, they overly pronate. So I've been
Yeah.
dealing with ankle sprains and foot issues and knee pain and low back pain and shin splints my whole career. Do you do a lot of like hips and under work?
Absolutely. And it's interesting you say that because people will come in, they'll say, oh, my foot or my knee, but you have to start at the pelvis,
Okay.
right? I take the x-ray and see, is the pelvis level? Um, People will have one leg shorter, and it's typically not congenital. They're not born with one leg
Oh,
shorter. As when the pelvis rotates, it pulls the hip up, right? And so one leg is going to be shorter. Well, then it's going to affect the ankles
right.
and knees, right? Because it's going to flow down. Like if your posture is off, so people will come in for knee pain or ankle pain, but really we have to level out the pelvis. So I start with getting x-rays of the low back and the hips. And then how do we correct that so that they're a little more even?
Got it. So
Because
why
then
does
also for
yeah.
men, I'll have to tell you, for men, it affects if your pelvis is off or your low back, not only is it painful, but it starts causing ED issues for men.
Oh man.
It causes prostate issues. For women, it can cause problems with infertility, problems with their menstruation.
Yeah.
So the low back is definitely, if you have knee issues, hip issues, you want to get low back checked.
So, Dr. Zamora, do you accept insurance mostly patients, or is it mostly private medicine, cash pay? How
Yeah,
does that work?
we don't accept insurance because a couple reasons.
Okay.
One, insurance will mandate what we're allowed to do and what we're
Yeah. You
not.
have to beg
And
them.
it's
Yeah.
yeah, and it's the system is broken, right? We have a system that 70% of people in the US are on one medication,
Mm.
one prescribed medication. 70% of the people. We're 75, we take 75% of the world's medication or 5% of the population. So our system isn't working. We have to do something different. That's why I'm passionate about it, and you as well. We see people are drugged out of their mind. They need to do something different. We have to say, how do we correct this, right? How do we do our part to change the system?
Incredible. Can you give us the name of your practice so we can give it
Yeah.
there, and we'll link that below 100%.
Yeah, it's Imagine Wellness Chiropractic Center.
Perfect. And that's in North Phoenix for the last 14 years, folks. I mean, and she's
Yeah.
taken the time to come here on our Healthy Habit podcast,
Yeah.
and she's been on
And
the
that's why
radio
we don't
show.
take insurance, because I think I got away from your question, because that's the system that doesn't work, and we're trying to be outside of that system. And usually it's more cost effective for our patients
Oh, wow.
if we don't take insurance, because we can offer them a discount that we couldn't if we were in network. We would have to be, you know, abide by, if they say your visit is $200, we have to charge $200. If we're out of network, we can say, hey, we can offer a discount.
Got it.
So some kind
Okay.
of saving.
So, what would be your favorite chiropractic kind of supplements that you've been using for 14 years? I'm sure you've recommended maybe, I don't know, a turmeric or
Yeah.
ginger or
Yeah, I love turmeric.
MSM, hyaluronic acid. I want to hear your
Yeah.
favorite supplements.
Some of my favorites are Standard Process. They've been around since 1929 in the US. Like they're the oldest US company, supplement company. Dr. Royal Lee started in 1929. They
Yeah.
grow all their own products on their farm in Wisconsin. And they look how much
Wow.
we love our work. They love it. I went to a webinar or a seminar, and the first 30 minutes they talked about the soil. I was like, oh, you
Yeah.
love what you do.
Yes. If that's how you're starting the
So
talk, yeah.
yeah. So I love Standard Process, but I use other ones. But I love Boswellia is great for aches and pains. You would want to take it with fats. So if you drink coconut oil in your coffee or tea, or you take omegas, you would want to take Boswellia with an omega or some kind of fat. I love Ligaplex 1 and 2 from Standard Process. Ligaplex 1, if you are gluten sensitive, because it's gluten free. Ligaplex 2 isn't, but I love those products. I love turmeric for sure.
Yeah.
I put it literally in almost every drink. So those
Turmeric.
are my big ones. And yeah, and vitamin D. Vitamin D is huge,
And vitamin D. Yeah.
Um,
So again, we have the full Standard Process line
cancer can
right
be
here.
reduced by 50%.
Say that one again.
Oh, yeah, I think so I think my network is unstable.
Yeah, we lost you there
I
for a
said
second.
vitamin D. I love vitamin D because there's a lot. Yeah, vitamin D can help reduce cancer by 50%.
Yeah. Just shows how important that is. Unbelievable. Okay,
For
we're losing.
patients too.
There we go. It looks like we got you back there. Okay, perfect. So that was the Standard Process line. We had Ligaplex 1 and 2. Dr. Zamora touched on Boswellia, turmeric, vitamin D, some options there to help start strengthening the nerves and joints and spinal cord, right? It's just so important because the nerves, they emanate right out of that spinal cord and supply all these end organs. And remember, all of our organs, they need the nerve supply to work. right? So if they're not getting the proper nerve supply, what's going to happen to those organs? They aren't going to be performing as optimally. Let's see. We might have lost Dr. Zamora there. All right, looks like we lost Dr. Zamora there. She was having some internet difficulties there at her office. But I just want to thank you, Dr. Roxane Zamora, Doctor of Chiropractic Medicine, for coming on the Healthy Habit Podcast today. We'll be spreading the word on to our patients and our listeners here. We'll put the description in the box below this video. Thank you for taking the time again, Dr. Zamora, and we really appreciate you coming on. And we're going to get Dr. Zamora back here on the podcast. We'll make it happen. Again, North Phoenix, practicing up there for the last 14 years. We're going to link her address below to her medical center. Thank you again, Dr. Zamora, for taking the time to come on the show.